Hello everybody, this is Stephanie Rose 88. I'm going to be making a video today about antipsychotics and particularly how I got off of antipsychotics. I'm thinking a lot about this subject because it's pretty controversial. I recently spoke to people about my mental health recovery, and so it got me thinking about this whole subject of psychiatric medication. Um, I thought I would start with a little bit of history. Um, the first time I ever took a psychiatric drug, I was 11 years old, and I had started seeing a psychiatrist and a therapist because I was very depressed. My parents divorced, and there was a lot of other stuff going on, and I was very depressed. So I confessed that to the psychiatrist, and I guess he suggested that I start taking Zoloft. Um, he also they almost sent me to the hospital because I was only 11. I had never spoken to a psychiatrist before, so I really didn't understand how the system works. And I told him honestly that I felt like I wanted to die. So he made my mom promise that she would watch me closely, and he agreed to let me go back home, and they gave me a prescription for Zoloft. I did take it, but I didn't take it very long. I remember really not wanting to take it, and I don't remember exactly how long it was, but I know I didn't take it very long. I know I stopped taking it even before they stopped giving it to me. I just, I really, there wasn't anything wrong with my brain. See, that's the thing, is that they immediately went to, oh, well, let's medicate her. Um, Instead of addressing, why am I depressed? What's going on in my life? Why am I feeling that way? It was, let's give her some medication. I was, like I said, I was seeing a therapist, but, it really just wasn't enough. So anyway, so that was the first time. Um, Flash forward to, I'm 14 years old. I'm much more depressed even. I'm very suicidal, and I've been starting to use drugs and doing a lot of other things and sneaking out at night, and I end up getting hospitalized for the first time, and I am put on Risperdal along with some other stuff I don't remember. I've taken a whole bunch of medications. I mean, it's I used to joke that I've taken every psychiatric medication there is. I've taken a lot of them. Everything from lithium, mood stabilizers, lithium, Seroquel. I've taken antidepressants. I've taken Haldol, Thorazine, Risperdal. The main drug that I was on for most of the time was Risperdal. Hi, honey. You want? Yes, I know. Yes. Um, when I was 14, when I was 15, and I was a freshman in in high school. I was taking Risperdal. I don't know if that was the only one. I don't remember. But I was really exhausted all the time. It really just knocked the energy right out of me. And one time, to the point where I was in homeroom and I fell asleep because it was early in the morning, and I was so tired from the medication that they could not wake me up. And they actually thought that I was taking illegal drugs, which at that day I wasn't. But I was, experimenting with drugs at that point, but I wasn't on drugs that day. But I was so knocked out from the medication that I could not wake up. And they put me in a wheelchair, and I remember waking up sort of in a wheelchair, and they're like, don't move, and yada yada, and it was kind of crazy. I have an issue with putting children on antipsychotics, on any psychiatric medication, but in particular antipsychotics. They are powerful medications, and it upsets me when I hear about children taking them. I think that it's too often people jump to that almost immediately, and very often children are much more frequently being diagnosed with mental illnesses when before they were more hesitant to do that, like, well, let's not diagnose you, you're only 12. Now, I mean, you could be 5 and they're saying you have childhood bipolar. And I really think that that's very, I mean, it's kind of going from point A to point Z really fast. And instead of trying everything else that you could possibly try, they're just like, oh, well, let's give you this medication. We don't even know how these medications affect a child's brain. They're still developing. And we do know that anti-psychotics in particular have some really hefty side effects, some of which I've personally experienced later on in my life. And we also know that the longer you're on these drugs, the greater the chance of you developing the side effects of these drugs. With antipsychotics, tardive dyskinesia is, involuntary movements of the face and the mouth, and it's irreversible, and you're much more likely to get it if you've been taking it for a long time. So I think to start children on something like that is just, I think that's very extreme. I do. I think that should be almost unheard of. I think it should be exceedingly rare for anyone under 18 years old to take something like that. Anyway, so I was put on Risperdal. My mother felt that I needed it. My mom felt that I had bipolar or whatever else they said I had. She felt that I had to take the medication in order to be stable. I truly believe that she felt convinced of that. It's not like, she was trying to do something bad to me. She, like many other parents, genuinely believe that this is what their child needs, because that's what they're told. The psychiatrist said I have a chemical imbalance in my brain, and that's why I'm having all these problems. And this drug is needed for that, to fix that chemical imbalance, and so she wanted me to take it. I hated it. I hated it with a passion. I hated it with a passion from day one, and I never wanted to take it. So every chance that I got, I stopped taking it. And of course, my life was just in turmoil for many years. For all my teenage years, up until I was 21, I was just going through constant mayhem, in and out of hospitals every few months, using drugs, all kinds of things going on. And, I would have maybe very, very short periods of time where I would do kind of well. Maybe there was like maybe 4 times the whole like within 8 years where I did well for a short period of time. And then whenever I did well, it was always like, well, you're taking your medication. Whenever I didn't do well, it was like, oh, well, you stopped taking your medication. That's why you're not doing well. And I knew that wasn't the case, because a lot of the times I was doing well and they thought I was taking medication and I was not. And a lot of the times when I wasn't doing well, I was taking medication. And I felt certain that I didn't need it, and that was not what was causing me to do well and then not do well. It was a whole bunch of other psychological problems that was going on with me, that I didn't want to address at that point. I was stuffing all my feelings down. I was cutting myself. I was doing drugs. I was acting very irresponsible and impulsive. I was doing everything I could to run away from my feelings. So that was really the main issue that I had, was running away from all the problems and feelings that I had inside that I didn't want to address. So I think that psychiatry has a way of just making it all about one thing. It's like, oh, well, you were just born with it. There's nothing you can do about it, and the only answer is to take this medication. And I think that they really don't have the scientific grounds to state that. I really don't. And I think that very often claims are made that are not justifiable and really aren't provable. And if you ask an honest psychiatrist, they'll tell you that, that they really don't know. It's a shot in the dark. I've had a psychiatrist tell me that. They're just like, well, let's see if this one works. Let's see if that one works. They can't prove that you have a chemical imbalance in your brain. It's not possible. A lot of what these antipsychotics do is they dumb down your frontal lobe. Okay, when they used to do lobotomies, they would snip that part of your brain, okay, to whatever varying degree, or shove a nice pick in your eye socket and jiggle it around. And their point was to mess up your frontal lobe. Your frontal lobe is what makes you who you are, really. You know, that's your personality, that's how you have feelings. To take away or to damage your frontal lobe is to pretty much reduce you to more of an animalistic state of mind. And the antipsychotics affect the same part of your brain. Basically, it kind of dumbs it down, you know. And so maybe, yes, maybe people's behavior will become more manageable. Maybe they will not have as many delusions. I don't know, but that doesn't mean that you have fixed something. The last period of time that I was on it, I was getting Risperdal injections. Okay, I was getting injections because I would always refuse to take it. So I was always getting caught, you know, that I stopped taking the medication. So you know, and I always had, like I said, my mom felt that it was extremely important that I take it. So she was always kind of like, you gotta take your medication, you gotta take your medication, you gotta take your medication, and I hated it. So I was forced to take it. I was in Greystone Hospital twice. That's a state institution in New Jersey. On top of the, you know, 35 other hospitalizations I had by the time I was 21. So I got out of Greystone the second time, and I was there was a visiting nurse coming to my house who was giving me these Risperdal injections, and I really, there was nothing I could really do about it at the time. Had a conditional release from the hospital, so I kind of, I mean, technically, I don't think they could have like taken me away if I refused, but I felt that if I didn't comply with what they were telling me to do, that they would have somebody come and, you know, say that I wasn't doing well, and they would send me back to the hospital. So I was nervous about that. So I did what they wanted me to do for about 6 months, and then I just decided I couldn't do it anymore, and I hated the medication. I had developed a pituitary tumor, which is pretty common with Risperdal. A lot of people who take Risperdal get an excess of prolactin in their body. It's a chemical, a hormone that is from your pituitary gland. I'm a mom now. I have 2 daughters, and I'm a breastfeeding mother. So I know prolactin has a lot to do with breastfeeding. But if you're not, if you don't have a baby, you don't want that chemical. You don't want an excess of prolactin in your body. It's going to cause your body to act like you're pregnant or breastfeeding. And for men in particular, Risperdal can have some really devastating consequences on sexual health. And I mean, men can develop breasts. They can start lactating. A lot of really terrible things can happen. And too often it's treated like it's no big deal. You know, a lot of times these psychiatrists act like if you have a mental illness, that means you aren't allowed to have a sex life, or it doesn't matter if you have a sex life. They act like, well, so you develop breasts and you start lactating, too bad, you need to take your medication. I think that the consequences, the side effects are very often downplayed and downplayed and downplayed, and the benefits are created from I don't know where, from pharmaceutical companies making lots of money. Anyway, so I wanted to get off of it. I was seeing a nurse practitioner at the time, and she didn't like me very much. But I convinced her she called my mom to make sure that she would watch me or whatever. I was an adult, by the way, but she insisted that she do that. She put me on the pills instead of the injection. So that was the first part of my plan. I got put on the pills, and then I cut off ties with the visiting nurse because I didn't really need her anymore. So I wasn't getting an injection anymore. And I was also involved in an outpatient program, and I just signed myself out of that. I said, I don't really need your services anymore. I'm doing well, yada yada. I don't want you. So I cut off those services, and that's when I stopped taking the Risperdal. I didn't have anyone from the psychiatric system involved in my life anymore at all. Here's sweetie. Okay, here you go. So I was completely by myself, and I didn't want to go through this totally on my own. You know, I knew that there was a good chance that I would experience some problems. I mean, I had heard voices before. I had psychosis. I had delusions. Um, I had experiences of being very paranoid that were horrible. One of the worst things I've gone through because I really believed firmly that people were trying to hurt me. And I'll probably make a video about that another time. But so I had these issues before. And I abruptly stopped the medication. I didn't go down slowly, which wasn't a very good idea, but I was just so sick of it that I couldn't take it anymore, so I just stopped taking it abruptly. So I called. I did some googling. I was trying to find someone who can help me through this that isn't a part of the psychiatric establishment. Because I don't want to go to any of them anymore. I've been hospitalized 35 times. I've never been helped. Nobody's ever helped me there. I don't want their help anymore. Who can I go to that isn't a part of that? Who I'm not gonna feel like if I say the wrong thing, I'm gonna get sent away, or who's gonna understand and just if I say I do get delusional, okay, so I'm delusional. Does that mean that I need to be sent away? Or can that be worked through? Can somebody just accept the fact that, okay, I'm having delusions, so what, really? I'll help me through that, Um, so I found Dr. Edmunds, and I really liked what I saw because like I said, that was kind of his philosophy, and I felt like he wasn't going to judge me for whatever I said to him, and I felt like I could be honest, I could be open. I wasn't going to have to be scared of, having all my rights taken away or being forced to take medication. I don't think people understand how horrible it feels to get an injection every 2 weeks against your will. Whether or not people thought I needed it, you know, I am sympathetic to that, but at the same time, I was still an adult, and I think I had the right to say, I don't want to do that, and I think that should have been respected, but it wasn't. So so he respected that, and he was in Pennsylvania and I was in New Jersey, and I don't drive, so it was hard for me to come see him. But we did speak on the phone, and he was generous enough to allow me to pay him on a sliding scale, and I was really unhealthy. I look back at those videos. I was overweight from the medication. I developed really bad acne that has never totally gone away. I was exhausted. All I did was sleep and eat. I was so hungry from the medication. I was exhausted. I had high cholesterol at 20 years old for the first time in my entire life. I had always been a very slender, pretty healthy person. So that was bad. So Dr. Edmunds, I would call him and I would be like, oh, today I had, I started having like these episodes of just intense euphoria, where I felt totally euphoric, and then I would have depression, and then I would, even for a short period of time, I started hearing some voices again. Um, and so I went through all that, but I was able to just talk to him about it, and he was able to, oh, careful, not so much. Thank you. Here. Okay. Here you go. He was able to give me advice on how to handle things. He actually referred me to a really good website. I'll see if I can put it in the video so you guys can see it. It was about people who hear voices. And they still hear voices, but they're able to get through their life even with the voices. He also referred me to a video that documented I think he was a psychiatrist who used to hear voices himself, and who had been hospitalized himself, but then went through school, got his degree, and now he works with people without psychiatric drugs. And it was his relationship with a woman who was going through psychosis and mania and all kinds of stuff on her own. And I thought that was really cool. He also introduced me to something called Soteria House, which was it was a home for people who had their first episode of schizophrenia, and they were either on no medication or a little bit of medication, and it was a different approach. It wasn't, the hospitals are like, these are, the people that are in control, and the patients are just kind of at their mercy. This situation was like, okay, we're all in this together, like, I'm not better than you, you're not better than me, the doctor isn't up here and you're not down here. We're just together, we're all people, and I thought that was really, really cool. And if you look into Soteria House, you'll see that people actually did really well. I think I would like to recommend that people read a book called Mad in America, and it's the history of psychiatry in America, and some of it is very hard to read. It goes through some really torturous practices that people went through. Here you go, sweetie. But it also goes through the rise of biochemical psychiatry. I know that it's extremely controversial. I'm not trying to tell people what they should and should not do. If you want to take psychiatric medication and you think it's helping you, then I'm not here to tell you not to do that. But I do think that it's pertinent to understand the history, why it started, how it started, who started it, and also to see what does it do, and what about people who don't take it, do they recover? Because psychiatry says that you can never recover, that it's just how you were born and it's going to be that way forever. So Dr. Edmunds, he would listen to me. I did come to see him at least once. It might have been once or twice in Pennsylvania, his office in Pennsylvania. And it actually helped my mom too, because when I told her I'm stopping the medication, she was very upset. Like I said, she was convinced that I needed it. So when I said I'm getting off of it, in her mind, she's like, well, she's going to get sick again. She hasn't realized that she needs the medication, and when she stops taking the medication, she won't be okay. And so she was very upset. When she saw that I was getting better, that I was actually, I went through a lot of difficulties, and I'm happy that I had somebody there who was willing to get me through that. Dr. Edmunds was helping me get through that, so I didn't have to do it alone, because otherwise I would have had to do it alone, and then I think it gave my mom some comfort too, that like somebody is there helping me, a professional, to her that made her feel better. So that was good, people need alternatives to the established psychiatric system. Not everybody is going to, a lot of people don't, quite frankly, benefit from that system at all. A lot of people are harmed. I feel that I was harmed from it. So to have somebody like Dr. Edmunds who isn't going to make me feel inferior, make me feel afraid, make me feel like I have no control over anything. Instead, he gave me my control, and he was just there to assist, and that isn't what you get in the hospital at all. No, Emmy, here, honey. Here. So it is totally possible to get off antipsychotics. It is possible to be in recovery, real recovery. I don't want people to get upset with me. Like, I can't tell anyone else what they should do, but I do think that that very often the fact that you were given psychiatric medication makes it hard for you to function without it. I don't think that it's the other way around. And I really think that people should look into that, And if you're taking antipsychotics or any other medication and you want to get off, if you're in, I guess if you're in the tri-state area, you could call Dr. Edmunds if he's accepting more patients, or you could contact someone that has a similar philosophy that he does, and maybe maybe you can get the help that you've been looking for. I know how it feels to be forced to take something that you don't want to take, that makes you feel horrible, and to know that you don't need it and want to get off, but maybe you feel afraid, maybe you want someone to support you, maybe you don't want to do it by yourself. I know that I didn't. So it's it's good to have people like Dr. Edmunds there. So I hope that more people will come up like him, you know, who are moving out of this psychiatric establishment and willing to try something different, you know, willing to think outside the box, outside of this biopsychiatric paradigm that has basically been put up on a pedestal as the only way to view mental illness. And I don't think that that there's any a warrant to think that that's the only way. So it wasn't my way, and I haven't taken. I got off Risperdal in October 2009, and it is July 2013, and I've been totally free of psychiatric drugs. So, and this is my second daughter. Say hi. This is Leora, and she's my beautiful baby. And I love being a mom, and I love being happy and healthy and free and free. So that's my story. I hope it helps somebody.